Welcome everyone. We love holding these webinars, and what we really love is seeing so many of you from all around the world joining us. So for some of you it's good evening, for some of you it's good afternoon, some of you it's good morning, some of you it's good morning. But regardless of where you're joining us from, thank you for choosing to spend your time with Poseidon Animal Health. We know how busy our lives are, and we know what it's like having horses, how busy our lives are. So we really appreciate you sharing your time with us today. Now, for those of you who have been to our previous webinars, welcome back. We do know we have so many new people joining us today. Some of you who have never interacted with Poseidon Animal Health before. So welcome. And as we work through this webinar, you will see how committed we are to delivering, information and education that is relevant but is accurate. And in a moment, I'll share our amazing technical team, and you'll see just how committed Poseidon Animal Health is to making sure that we give you the right information. For the next hour, we will be discussing a topic that is of great interest and great concern to so many of us. And we really hope that you can stay to the end. If you can't for any reason, we will be recording this, and we do send out the recording to you. So we understand life goes on. We can do what we can today, but if you can't stay to the end, please be reassured that you'll get to see that. So we'd like you to stay around to the end because we are doing an amazing giveaway, one in Australia, one in New Zealand, and one in the US. So please stay around to the end. The other thing I wanted to mention is that we do love to have questions from you as we go through the webinar, and we have our technical team all standing by to help answer the questions. Just know that anytime you consult Poseidon Animal Health, if it's a question around your horse, nutrition, the products, we have our incredible team who are either a vet or an equine nutritionist answering that. So just be reassured the information you get from us is coming from people who are qualified and experienced to give you that answer. And that is something I think we need to take responsibility for as horse owners. We often say our horses can't ask the right questions. We need to ask the right questions and make sure we're getting the right answers. And that's what today's webinar is all about. So just in terms of who is joining us today, I'm Linda Goldsmith-Lord. I'm actually the owner and founder of Poseidon Animal Health. As a long-term horse lover and animal lover, I became really interested in the impact of gut and gut microbes and gut health and how it impacts on our animals, and created a company that is now global, that is really changing the way that we manage our horses from a gut health perspective. And we like to think we do it differently because we are literally about not just evidence-based supplements, but really delivering education that will make a difference for you, because most of the team are horse owners and we know how challenging it can be, and we just want to get the right answers. So with this webinar and everything we did from Poseidon comes great commitment to delivering the best that we can and keeping things up to date. And as we talk through the webinar tonight, you'll hear us talking about some concepts that are new, that are changing the industry, changing the way that we see our horses. And with every speaker today, this morning, you'll get the sense of true love for our animals, and we all just want to make a difference. So that's enough from me. I would like to now introduce Dr. Erin Roddy. And Erin, if you could just quickly, let everyone know who you are, what you're doing, and why you're at Poseidon.
Hi, everyone. Thanks so much for joining us. I am here in Ocala, Florida, and I have been with Poseidon for 7 years. I used to live in Sydney, Australia, and I started working for the company there. And then I've now returned back to the States. And I love everything about Poseidon. I love the science behind our products. I love our commitment to horse welfare and to really shaking things up and doing things differently in the supplement industry.
Thank you, Erin. And I've done many webinars with Erin, and every time I learn something new. Her knowledge is incredible. We are very blessed to have her as part of the team. Dr. Chris Mortensen.
Kia ora, everybody. I'm in the Waikato in New Zealand, but see a lot of people from back home in the US. I grew up in California, did my PhD at Texas A&M, and then I was mainly a professor at the University of Florida before moving overseas a few years ago, and live here in beautiful New Zealand. And been with Poseidon over a year now, and just incredible company led by Linda and her wonderful husband, Peter. It's just an incredible company, and really, really excited to share some of this information with you today.
Thank you, Dr. Chris. And again, we are so blessed to have Dr. Chris as a very experienced and qualified equine nutritionist as part of the team. And you can see what we have is an amazing combination of having our vets and nutritionists working together. It's rare in terms of other companies, so we're really proud of that. Dr. Tiffany.
Hi, everybody. I am Tiffany Hall. I am currently in Ocala, Florida, but also practice in Lexington, Kentucky. And I have been with Poseidon for approximately 8 months now. I joined on because I really love this company's commitment to empowering the horse owner and taking care of their horse. And that's why I've joined on. Really glad to be here and excited for what you guys are going to hear about our new approach to metabolic horses tonight.
Thank you, Dr. Tiffany. And Dr. Tiffany also brings an incredible level of experience and passion and knowledge. And I often sit back and go, I am in awe of what we created at Poseidon. To have people with this caliber as part of our team is incredible. So thank you, Dr. Tiffany, for being part of the magic that Poseidon offers everyone. So again, I just want to reinforce the information you're getting tonight is coming from a team incredibly qualified and experienced to do so. And given that there is so much information out there, particularly on social media, and I should say misinformation, because that's the challenge we have. There is a lot of misinformation out there. And what I love is what you're hearing tonight is actual science backed by people who are credentialed to deliver that information. So lots to get through. In terms of what are we covering in the next session, in this session is really understand the modern metabolic horse and why it's an issue, and sadly how common it is. They're looking at the role of insulin glucose testing and how important it is about getting baseline, understanding what we're actually playing with. Talking about the role of medication, and then if you're like many horse owners, what happens when that's just not enough? And we'll be looking at what are all the other things that you can do. Excitedly, then we'll move into looking at flavonoids. And some of you may have heard of the term flavonoids. Some people in Australia and New Zealand are probably very familiar with our product, Metabolic, which we'll talk more about later, which is absolutely a groundbreaking combination of flavonoids. And we'll talk more about why they're important and why did Mother Nature deliver these flavonoids to our horses in the first place. And then finally finish in with some case studies, because it's really important that you get to see what does this all mean and what happens when we put it into practice. So again, lots to get through. As we go through any questions, please put it in the Q&A section. If it goes into the webinar chat, it will get missed. And as I mentioned, we've got our team answering questions. So if you see their head down, it's because they're actually answering questions. So let's get started. And I'm very excited to hand over to Dr. Erin Roddy.
Thanks, Linda. It's very exciting to see so many familiar names in the chat. So that's cool. Hi, Imogen. I lucky to know so many people in so many countries that are interested in education. All right, so our first topic is going to be understanding the modern metabolic horse. And we completely understand at Poseidon how challenging managing a metabolic horse is and how frustrating and painful it can be for you and the horse, which is the big reason that we are doing this topic in our webinar. I think this is actually the third time we've covered metabolic health, and we still have questions and we still are looking for better answers, and hopefully we keep finding them and we can share them with all of you. So I have a lot of owners come to me and they feel that they have done something wrong because their horse is metabolic. They've fed it the wrong thing, they've managed it incorrectly, and they're a bit sometimes guilty or shameful or just frustrated that their horse is metabolic. And the first thing I want to put out there is most of the time no one's done anything wrong. Not the current owner, not the past owner, not anybody. We have really changed the way that our horses lived. Horses have been on this earth for 55 million years, and they have been domesticated for about less than 0.05% of that time. We are still inside dealing with a wild horse. Even the fanciest warm blood dressage horse going around is inside very much still a wild horse. Wild horses were designed to move constantly. They were designed to deal with seasonal variation. It is normal for a horse to get skinny in the winter and then put on weight in the summer. That's normal. They were designed to eat up to 40 to 50 different kinds of diverse forage over the course of a season. They were designed to live in a herd. Most of our modern horses, despite being wild on the inside, do not experience any of that lifestyle. They're often very restricted in their movement, whether they're confined to a stall or they're in a small paddock. They have cultivated forage. Most horses I see, we are really working hard to get 5 kinds of forage into their diet, and a lot of horses see a lot less. We have a huge reduction in the seasonal changes that they experience. Most people like their horses to be well covered at all times of the year. And our horses are socially isolated, and that affects them both physiologically and psychologically. So we are at fault because we've changed everything about the way the horse lives. But that's not something that we've done wrong. It's just the nature of our modern lifestyles and trying to deal with what is effectively a wild animal that has been domesticated for a very short period of time. So I guess this is just to say it isn't your fault that your horse is metabolic. It's really just the nature of domestication. And what we're going to try to do is give you some tools to help manage it. So why are we talking about this? Why have so many people, I'm amazed, so many people have shown up to this webinar? Because there is a rising case of metabolic disorders all over the world. In every country, we are seeing more and more metabolic horses. We estimate about 20% of our non-draft breed horses are currently dealing with some kind of metabolic issue. And the AVMA estimates that up to 40% of all horses may be at risk. So that is a big portion, and it's growing all the time. So this is definitely a topic on everybody's mind, and it's something we want to help you guys out with. Why do we care? Why do we care that our horse is metabolic? Because metabolic disorders lead to these consequences. And these consequences are not fun to deal with, particularly, obviously, laminitis is the hot topic, but it actually leads to muscle atrophy, fatty deposits. It can predispose the horse to lameness, osteoarthritis, loss of condition. These horses don't look well. They often have ligament and tendon injuries and foot issues, muscle atrophy. These are big consequences, and we're seeing them in younger and younger horses. When I was sort of coming up as a young horse person, metabolic horses were always old. That was something that happened at the end of their life. We are now seeing 5, 6, 7-year-olds that are already dealing with metabolic disorders. And that is a long road when you have a young horse that is already showing metabolic signs to battle all of these consequences for the duration of their life. So it's serious. It's something we really need to make sure we're getting on top of. It's also not anymore just a fat pony problem, or I would say when I was coming up, a fat old pony problem. It is a whole body inflammatory condition, and it's not just about the horse being fat. It's not just about the horse being a pony. We see this across our warm bloods, across our Spanish breeds, quarter horses. Almost any breed can present with metabolic issues, and they don't have to be fat to be showing signs of metabolic dysregulation. And that's just something to keep in the back of your mind as we start talking about clinical signs, is that you might be seeing this in your young horse. You might be seeing this in your young horse that's not overweight and that isn't a pony. And it's just to kind of tip off that maybe what's going on is actually a metabolic issue, and how do we get ahead of that before we see those clinical signs that we spoke about. I also want to explain that metabolic dysfunction is not just one thing. Obviously, sugar can play a role in a lot of horses, but we also have inflammatory processes going on, and we have a mitochondrial slowdown going on. And a lot of this is genetic. This is bred into horses who were designed to live a very different lifestyle than they're living now. And that particularly can come down to certain types of breeds. There are specific breeds that are even more predisposed than others. It's not just ponies, although ponies are a big part of the group. But you might do everything right in terms of diet and management in this horse's lifestyle, and still what is going on with them under the surface is going to result in these problems. And that's why we need greater solutions than just diet and management. So I just want to go over the first sort of, I guess, part of our triangle, which is insulin resistance. And this is probably pretty familiar to most people. I think we understand the relationship of glucose and insulin pretty well. Obviously, glucose is the energy currency in the cells. That's what the cells use to work. Insulin is actually the key that opens the cell to be able to absorb glucose. So when glucose comes into the bloodstream from the diet, it triggers the release of insulin. Insulin then binds to the receptors, and that allows the active tissue to absorb the glucose so they can use it. Our active tissues are our brain, our muscles, and our liver. Those are the organs that are designed to use glucose, and they burn glucose to make energy. That's how the system is supposed to work. If there's too much glucose in the blood, then there will be too much insulin, and the receptors will become resistant. we will then have too much glucose and too much insulin floating around in the bloodstream and bound to the receptors. And that glucose will have to go somewhere else. And it normally goes to being stored as fat. This is actually how the horse evolved to make use of what is supposed to be very sparse sugar and starch in the diet. Horses are supposed to work hard to get their sugar and get their starch. They're not supposed to see it all the time. They're supposed to see it seasonally. So they evolved to be able to deal with seasonal variations and highs and lows of the availability of sugar and starch in their diet. Unfortunately, now most of our horses are seeing too much sugar and starch, and they're seeing it all the time for what they were evolved to deal with. So there is an evolutionary predisposition to insulin resistance. It's not necessarily something we've done wrong. It's just our modern lifestyle not going hand in hand with the horse evolved to deal with. Unfortunately, when we have too much glucose and insulin in the bloodstream, we do start to deposit that glucose as fat. Those fatty deposits contribute to inflammation. They can contribute to further insulin resistance, and they push the system towards laminitis and tissue damage and all of the other consequences that we spoke about. So that's sort of the insulin resistance part, which I think most people understand, but just to make it really clear. We then have the next component, which I think a lot of people aren't that familiar with. Again, we are dealing with what on the inside is a wild animal. Horses were designed to deal with stress and experience stress in short bursts. I say it all the time, but it works. They were designed to run from the lion for about 10 minutes. And they either made it or they didn't. Either way, the stress ended. If the herd made it, stress is over. If somebody didn't make it, the stress is still over. We aren't going to hang around and be stressed about the fact that somebody didn't make it. If you're the horse that didn't make it, you're no longer with us. If you're the rest of the herd, you made it and you're good. Unfortunately, now our horses are dealing with stress constantly. They are stressed for hours, they are stressed for days, they are stressed for weeks. Those come from a bunch of different factors: travel, their diet, being socially isolated, competing, having dysbiosis in their microbiome, being confined. All of these things contribute to psychological stress in the horse and physiological stress. That stress causes cortisol to be released into the bloodstream consistently, which is not what horses were designed to experience. So cortisol is supposed to be released. That causes more glucose to be directed to active tissue so that we can run away from the lion, and then it's over. When the cortisol stays in the system all the time, we then get insulin dysregulation in the same way that we get it from having too much sugar in the diet. So it's something we really need to think about, is that not only do we need to reduce sugar in order to help our metabolic horses, we need to reduce stress. The two are just as important. And I think that's a piece that a lot of people are missing. They reduce the sugar, but they don't look at the stress. And the stress causes just as much dysregulation and resistance as the sugar. So chronic stress, chronic elevated cortisol leads to chronic inflammation. It can be low grade. It doesn't mean we have an raging infection going on, but we just have too much cortisol floating around in our bloodstream, and this is causing chronic low grade inflammation. That inflammation also damages our insulin receptors. It also causes oxidative stress, which perpetuates this damage. We then get sort of this vague pain. Most of our metabolic horses sort of present with this just sort of vague sense of not being right or being in pain. A lot of them are obese. That comes from this low-grade inflammation, and a lot of them have a strain on their liver. And remember that the liver is one of the active tissues that loses glucose. So if the liver starts to falter, it starts to not process glucose as well, and that contributes to a vicious cycle. So all of these pieces play together. They all correlate with each other. They all feed back and forth with each other, and it becomes a very difficult cycle to stop. So this is how the system breaks down, particularly chronically. So we have high sugar or high stress. That leads to excess insulin in the bloodstream. Our receptors stop responding, so they stop letting glucose into active tissue. We have glucose that remains in the circulation where it doesn't belong. It can then start to be stored as fat because the body interprets that we are in a time of excess. We then have more insulin secreted, and it becomes this vicious cycle where it just go around and around and around. Insulin, stress, sugar, inflammation, oxidative stress, tissue damage, organ damage. It becomes very hard to reverse. And that's why so many of us are so frustrated trying to deal with these metabolic horses that just don't seem to get better. Another of the underlying factors that, again, are nobody's fault and are just part of these horses' genetics are the mitochondrial slowdown. So the mitochondria are supposed to use energy and actually be the workhorse of the cell. And when they slow down, they lead to an energy dysregulation. So they're inefficient, they don't use energy well, and that excess energy is then stored as fat. So again, the horse's mitochondria are not working in the way that they should. And so that leads the horse to feel that they're in a time of excess, even though they may not be, even though their diet may have very little energy in it. Because the mitochondria are so slow, they're actually not using the energy that they do have. This can lead to an energy imbalance in hoof tissue and then result in a predisposition to laminitis. So all of these things play together, and all of these things contribute to why we're having a hard time. Funny, it's like I planned this slide in advance. So we have a cycle of dysfunction: insulin resistance, inflammation, mitochondrial damage. All of these things keep feeding back into each other to keep our horses metabolic, often despite doing everything we can to manage them. I meet so many people, a big part of my day is looking at diets and helping people correct their horses' diets. And the number of metabolic horse diets that I looked at, and they're absolutely perfect, and there isn't anything I would change, and everyone is doing everything right. And it's just because we are in this cycle of dysfunction. We cannot get out of it. And so we need tools that work at the cellular level. And sometimes that's medication, and sometimes that's other things that we'll talk about a little bit later. But this is what's going on. When you feel like you're doing everything you can, you are managing this horse. I meet people that it is a full-time job managing their horse, controlling the diet, controlling exercise, feeding them correctly. One of the most heartbreaking things I see is people that try to reduce calories to reduce the sugar intake, and then the horse ends up with gastric ulcers because they're not getting enough forage because we've tried to reduce the calories so much. And that is an even worse vicious cycle. So I know everyone out there is working really hard, as evidenced by them showing up at this webinar. And we are hopefully going to explain some tools you can use to get out of this cycle and get off this merry-go-round. So what should we do? I think the most important thing to get out of this is if you don't already know that your horse is metabolic, I want you to really take a hard look at whether or not your horse could be metabolic. A big part of that is breed disposition. Obviously, our ponies, our Spanish horses, our warm bloods, your typical good doers have a greater predisposition. Body condition score is a factor, but not the only factor. I see a number of horses that have big cresty necks, fatty deposits, and they are ribby. Fatty deposits are certainly important, but again, a skinny horse can have fat deposits. So you need to look at that. Your horse may not necessarily be obese. Obviously, if you're seeing laminitis and recurrent hoof abscesses is often a sign that we have inflammation and a failure in the system in the hoof, because that shouldn't be happening over and over. And often that's the first sign of laminitis, is recurrent hoof abscesses in a particular foot. If a horse has inconsistent energy, particularly as paired with their feed, I meet a lot of metabolic horses where they're getting fed a lot of energy and the horse is a little bit dull and not responsive. And that's telling you that horse is not processing their energy correctly, and they might be at risk of being metabolic. Excessive drinking and eating and urination, obviously the easy keeper horse. These are signs that you need to look into things a little bit further. There's a really interesting study that ponies that tested with an insulin greater than 45 actually have a 69% greater risk of developing laminitis within 4 years. So figuring out whether or not your horse is having metabolic symptoms, whether metabolic dysregulation is their issue, is really important in terms of preventing the consequences that we spoke about earlier. So we want to address this early. We want to identify these things in our horses. We want to recognize that maybe we're not feeding them a high sugar diet. Maybe they're not on lush pasture. That doesn't mean they can't still be having metabolic dysregulation. These are some of your early clinical signs. And then Dr. Tiffany is going to tell us what to do if we think that we are dealing with something like this.
All right. So thank you, Dr. Aaron. As Dr. Aaron mentioned, we're going to look for certain things that lead us to believe that your horse should be tested for metabolic dysregulation or insulin dysregulation. I've been charged with the task of demystifying insulin glucose testing. I'll let you know that it is a mystery at times, even to your veterinarians. The underlying pathophysiology of this disease is still being determined in many ways. And it's easiest for me with horse owners to compare it to type 2 diabetes in people, because obviously we kind of all have a little bit that we know about that. But in terms of actually interpreting your insulin and glucose levels can be fairly simple to do. So why do we test? As Dr. Aaron mentioned, not all horses are going to be showing signs of metabolic dysregulation all the time, but they may be predisposed. So consider your breed, your clinical body condition, how your horse looks. Again, things like energy levels. Are they easy keepers? They can live off air, things like that. Even if you've never had an episode of laminitis, even if you think your horse isn't metabolic or overweight, there might be an indication that you should do some endocrine and metabolic testing. Numbers are also used to give us clarity and help guide treatment in these cases. And the most important thing is that we use seasonal testing, so serial season testing every single season, to help monitor your horse and make adjustments to those recommendations as we go along. I'm done trying to get the slide to advance here. There you go. So I recommend always that a full endocrine and metabolic profile be performed at the same time, at least initially. And that is because insulin dysregulation can be caused by equine Cushing's disease or pituitary pars intermediate dysfunction. So you don't want to just measure insulin and glucose levels, but to also consider your ACTH levels as well. In addition to the resting insulin, glucose, and ACTH levels, a complete panel will provide you with leptin and potentially adiponectin as well, which can just kind of, again, help confirm and differentiate the two if you have an overlap of equine Cushing's and equine metabolic syndrome. The baseline insulin and glucose levels is a good screening tool. It's been most often recommended that that be performed in a fasted state. So we want to perform that first thing in the morning before your horse has been given any kind of meal. Finish their hay, sometime overnight through the night hours, but not offered new hay and not out on grass prior to pulling that resting glucose and insulin level. The oral sugar test there's two different forms of this. This is preferred specifically by internists in particular, as it allows us to evaluate real life handling of glucose and insulin. So we have two forms of it being performed, either in response to a known volume of oral sugar that's administered, or we have you go ahead and feed your horse as normal and then pull the blood after they finish their meal. That gives us an idea of how they're handling the sugars that they're naturally exposed to. So what do the test results tell us? If you have high insulin with a normal glucose, that may indicate that you're early in an insulin resistant state. So in other words, the cells are not responding appropriately to insulin, and therefore you have to produce more insulin in response to glucose in order to push that glucose into your cells and into use for energy. If you have high insulin and high glucose, then that's an advanced insulin dysregulation and resistance at the cellular level. So your pancreas keeps responding to higher and higher levels of glucose and pushing out more and more insulin, but your cells are just not capable of taking that glucose up. And then if you get a normal insulin level with low glucose, we recommend retesting in that situation. Critical things to remember when you're having the testing. First, feed as directed. Follow your veterinarian's recommendations. They need to know what your horse has been fed or not fed and at what time it was fed in order to interpret these results. With the dynamic testing, again, if your veterinarian chooses to have you administer a normal meal prior to testing, that should be pulled at about 60 minutes post-feeding, post-finishing that meal. And that is because that's the comparison that we're making. We know what level insulin and glucose should be about that time post a feed. And if you feed a little bit late or you feed too far in advance, then we can misinterpret those results.
So,
You
Dr.
want to
Tiffany,
avoid stress. So horses should not be stressed during an acute episode of a metabolic crisis or laminitis. Should wait until they're better under control and back at home before doing the testing. Oftentimes, we'll just presume a horse is suffering from a metabolic episode of laminitis if they don't have any other predisposing factors to laminitis and start treatment appropriately for that. But the testing should be delayed until they're back home. Both exercise, sedation, and again, feeding can affect the test accuracy.
excuse me, Dr. Tiffany,
Yes.
question, will you cover in a moment what a normal insulin level reading should be and like what the difference, Dr. Erin mentioned earlier about levels above 45. Will you share in a
Yes.
okay, perfect.
Yeah, we do. I think it might be the next slide or a
Perfect.
couple from now. Yeah. So we don't have the actual numbers in this because it's going to depend on where you have the testing performed and what like units they measure in. So differences between reporting numbers in the US versus in Australia. But independent of that, whatever those levels come back as, your veterinarian will interpret them and your horse will be diagnosed as either normal, borderline, or severely dysregulated, depending on those results. Hopefully that helps clarify it a little bit. But those values are dependent upon the lab through which the test is submitted, the actual number value. So say your horse is diagnosed as being insulin dysregulated. What are we going to do about it? Well, first, we always aim to control what we can. And what can we control? We want to lower the non-structured carbohydrates that the horses are taking in. That can be done through choosing feeds or ration balancers with low NSC values. We very commonly recommend that you get forage tested if you can, or buy through a hay supplier that tests their forage. And that's because oftentimes our horses that are dysregulated are actually getting everything done right. However, the sugar in their hay is unpredictable. So different batches, different cuttings of hay, one Timothy from one area of the country versus a Timothy or a grass hay from another area of the country are going to all have different sugar levels. So forage testing is really, really critical. You want to make sure that they have all the nutrients, vitamins, and minerals that they need. So again, a ration balancer or a low non-structured carbohydrate feed, complete feed, is beneficial. We can manage our horses' stress levels by making sure that they have friends, forage, and freedom. So allowing them turn out as much as possible without being out on actively growing grass, particularly first thing in the morning. And then lowering stress levels as you do things like taking them between show and transport and travel, which we talked about in our last webinar, if anybody wants to go back and watch those. Movement and exercise is also very critical in this scenario. The goal in the movement and exercise is to help improve insulin sensitivity at the tissue level, as well as decrease their body condition score. So for horses that are overweight or obese, we want to get the weight off of them. So those are things that we can control, and it's always ideal to have it managed through the insulin dysregulation, excuse me, controlled and managed through our dietary and management practices rather than medications. So we're going to discuss now the roles and limits of medications. And in case I do not remember to say it with each and every medication, it's very important to ask your veterinarian about the use of medications for your specific horse. Again, these are usually stopgaps while we get management under control and in place. It's not intended to be a long-term solution. However, they do play a critical role during an acute crisis, particularly with an acute laminitic episode. The ultimate goal is better glucose control and lowering our insulin levels to decrease inflammation, particularly at the hoof level. So Not all drugs that have been studied and used in people with type 2 diabetes are effective in horses, unfortunately. But most of the medications that we use in our horses are a result of their being studied in humans instead. Horses differ significantly in humans with relation to the bioavailability or absorption of the medication, and therefore how much of the medication is in our system in order to benefit the horse. This is the nature of like their continuous grazing, their modifications of their gastrointestinal tract compared to ours, and it can be affected by feed type as well. Their unique microbiomes, their individual liver function assessments, and inflammation can also influence drug metabolism and efficacy. And then any concurrent conditions or stress may predispose us against using that particular medication in your patient.
But Dr. Tiffany, just
Yes.
I guess a comment. You mentioned earlier the importance of having testing, and this almost reinforces that regular testing because if you sometimes we give a medication and we just assume it will work, but really
Right.
we're not really going to know unless we go back in and retest. Would you agree with that?
Correct. Yes. Yeah, you definitely have to retest these as you go along. Again, I recommend that testing be done at minimum every season, so quarterly throughout the year. And then usually we recommend testing depending on the medication within 30 days to 60 days of beginning that medication. Again, the medication itself, the goal is to not have it on long term, and to get other things in place and on board so that we can lessen the medications being administered systemically. Of all the medications we're going to talk about this evening, pergolide is the only one that is directed and labeled for therapy in our horses. And it is specifically labeled for the treatment of pituitary pars intermedia dysfunction or equine Cushing's disease. So its effect in insulin sensitivity and improving insulin glucose metabolism is indirect as it controls PPID rather than altering the insulin glucose dynamics. And this one, if your horse is a PPID positive horse, it is a lifelong medication. Horses go on it, stay on it. Their doses may need to be adjusted pending their ACTH levels and their clinical symptoms. And so, again, this is something that we generally recommend testing every 4 to 6 months in horses with PPID, but still testing their insulin and glucose levels and their metabolism seasonally. Thyro-L or levothyroxine is a synthetic thyroid hormone. It is used in order to increase the metabolic rate in your horse and in people. So we use it specifically to increase insulin sensitivity through direct action, but as well as through weight loss. So this medication is used in an acute period, typically in an obese horse that cannot be exercised due to lameness or laminitic episodes, or perhaps we just need to get a weight off them faster than they're able to lose it on their own. So it's a short-term medication used again for weight loss, guided by your body condition score, with the goal of getting horses off of it as soon as we can. The limitations are, of course, that we are suppressing our body's natural production of thyroid hormones, and this can also lead to muscle loss and metabolic demand. However, adverse effects reported in people, including alopecia, sweating, diarrhea, weight loss, and anxiety, have not been shown to be present in horses, but we don't always know. In women, there's actually an increased risk of bone loss as well when they're on thyroid supplementation, and a risk of bone fracture, which of course would be a negative in our aging horse population. Metformin is a drug, and it's the preferred medication for type 2 diabetes in people. Has great effects in people in affecting insulin glucose dynamics at the tissue level and cellularly. However, it has very poor bioavailability, meaning it is not absorbed well in horses. Thus, we don't observe the benefits in horses that we do in type 2 diabetes with the use of metformin. However, metformin does act locally in the gut, and it will reduce intestinal absorption of glucose in horses, which thereby improves insulin secretion and regulation. But in that particular study, the insulin dysregulation was experimentally induced rather than naturally occurring in these horses, and was administered on a fasted state by nasogastric intubation. So it's hard to determine if we see those same effects in our individual horses. So again, this goes back to the idea that not all medications are going to work as they did in a study, and they're not going to all work in all horses as they do in one horse. One horse might have excellent response to metformin, while 10 others have very little response. So pioglitazone is another one that's, again, a human medication. It activates a very large word, peroxisome proliferator activated receptor gamma. This is a receptor in cells that alters gene expression, and therefore it improves insulin sensitivity by shifting our cellular network metabolism and increasing glucose uptake. Experimental studies in horses does demonstrate increased adiponectin concentrations and decreased insulin in response to an oral glucose test. Side effects in other species are very significant, can be weight gain, pulmonary edema, peripheral edema, and liver effects. So our safety profile in horses is unknown and it's quite expensive, but in an acute case or one that's not responding to other medications, we have used this in the past. So ertugliflozin, all the fun words that we have in this group of medications. Again, from a human medication, it is an SGLT2 inhibitor. Many people often are commonly referring to this as the horsey Ozempic. And it is important to understand that this is not Ozempic. It actually does not improve insulin glucose dynamics at all, whereas Ozempic does improve insulin dynamics in people. However, this medication, on the other hand, works by flushing glucose out through the urinary tract. So it takes glucose that should be used to produce energy and instead dumps it out the kidneys and into the urine. It is commonly used and recommended in acute hyperinsulinemic associated laminitis cases because you see a very rapid response to this medication in which glucose levels come down, insulin levels come down, and thereby inflammation comes down. These horses get much more comfortable very quickly on this medication because of the decrease in the inflammation in the hoof. However, again, it's not designed for chronic long-term use. It really should ideally be used in the short term and then transitioned off of it when possible. This can be really frustrating, I know, because you see this huge, wonderful response to this drug. But remember that what it is actually doing is not improving the dynamics within your horse's body system. It's actually removing glucose that's meant for energy from the system. Sorry, just one other real quick on this medication is that you should have uh, serum biochemistry checked pretty regularly while you're on this medication because it does shift the body from using glucose as an energy source to using fat as an energy source. Our horses can then develop hyperlipemia or increased circulating triglycerides, which is fat, and ultimately end up with fatty liver disease or liver dysfunction. So very important that you regularly monitor your horse while it's on this medication. So long-term use of any medication, doesn't matter what it is, can have an effect on our bodies, on horses' bodies. A lot of this has to do with the load on the liver as it processes these medications. These medications obviously are not 100% absorbed through the stomach and the small intestine and will reach the hindgut of our horses, altering their microbiome in the process. Further, they can lead to oxidative stress and mitochondrial fatigue, furthering that, vicious cycle that Dr. Roddy spoke about. Some drugs, medications do result in what's called a tachyphylaxis. It's a really fancy word to say that your body becomes resistant to the medication. The receptors are either desensitized or downregulated and no longer produced by the body. And so they will kind of fatigue. So again, to summarize, medication definitely has a role, but drugs need to be used strategically and not indefinitely. We really hope that we can get horses managed through nutrition and natural bioactives. And the goal is ultimately to improve the physiology at the cellular level in these horses. So what do we do when everything, again, as Dr. Roddy said, you're doing everything right. You're soaking your hay, dumping the water, you're testing your forage and seeing that it is low in non-structured carbohydrates. You're limiting your grain or complete feeds, or you're just using a ration balancer. You're using grazing muzzles, you're using dry lots, you're using, um, you know, controlled grazing out on pasture, and you're still having problems and you're insulin glucose dynamics on that seasonal regular testing still remains uncontrolled. What do we do now? And that's where we hope to give you an alternative with our new knowledge of flavonoids. I'll pass it off to Dr.
Yeah,
Chris.
yeah, thanks, Dr. Tiffany. Flavonoids, this is, and these compounds are so exciting. Anybody that knows me at Poseidon this is uh, one of the products we have metabolized that I'm just so excited about, and I scream about it because as a scientist, these are compounds that I would study. I guarantee you, if I was still at the University of Florida conducting more research, these are things that I would take and run with because I was looking at vascularity, nutritional impacts on tissues in horses, and everything I've seen in the research with flavonoids has me so excited. And to explain equine science, or what we do as scientists, is we take what's going on in other species, primarily human medicine. And then as scientists, we go, oh, this is working really well in people. Maybe we should look at it in horses. So when I talk about flavonoids, it's one of the things you're hearing a lot in the last few years are superfoods, right? Polyphenols. It's one of the things they say is a glass of red wine every night is good for your heart because there's research to show that these polyphenols or flavonoids help circulation. We are catching up now with in our horses where the emerging research in the last few years on these flavonoids is just absolutely exciting. And I'll highlight a little bit of it here. So, what are the flavonoids? These are plant-derived bioactives. So they come from nature, nature's medicine, all of these things that we're finding out in our diets that are so good for us. We now know they're actually good for our horses too, and that is what the research is showing. To also take this into consideration, one of the things that's really shifted quite a bit in the last 10, 15 years with horse nutrition is where we were, and we had to kind of go back to what nature intended for these animals. So we can learn quite a lot from our wild or feral horses in what they're eating, what they're doing, and how that impacts their physiology. Because we haven't taken the wild genes out of these horses. They're still designed to eat small meals all day, to wander around and eat a variety of foods. So what we've done is we've taken that choice away from them and we feed them generally one source of fiber, one type of hay. We might feed them a little extra chaff or grain or bagged feed, and then we'll try to make sure we meet their vitamin and mineral requirements. But we've taken out all the variety of a diet that a wild horse gets. So wild horses eat all sorts of things throughout the year because they have to survive, but it also impacts their physiology in many beneficial ways. So in nutrition, what we're doing around the world, my colleagues, in Europe and in the Americas and now here in Australasia, is we're going back to nature. We're going back to putting in what these horses were intended to eat, and that's where these flavonoids are playing a role. Now, with that being said, let me ask you this question, everybody listening, is how many different varieties of fiber are you giving your horse each and every day? Typically, with my horses, we feed one, maybe a mixed grass hay with some alfalfa or lucerne, and then we add some things to make sure they're in proper body condition. Maybe they need some more energy if they're competing. And then we always make sure they have a vitamin mineral mix. Every horse in the world needs a vitamin mineral mix. But there's no diversity in their diet. It's like me eating broccoli every single day is my only vegetable, which I love broccoli, plenty of it here in New Zealand, but I need a variety of in my diet for not only my gut microbiome, but for my overall health. So typically with our horses, we're still just giving them very limited options to eat. And we've taken away nature's magic, right? We've given them that variety. Then you throw in the stress and everything else we do with them. And again, these wild genes are still there. They're just very stoic, right? So that's why I get really excited about things like the flavonoids and the different things that they can do. Now, when we talk about metabolic horses, here's a good analogy. Think of pathways in the bodies like a walkie-talkie system. So the horse is eating their meal, and the gut is, on the walkie-talkie, talking to the liver. Here comes a bunch of sugar. Okay, and the liver gets the message and goes, okay, now the liver's kind of a control center for some of this, and it's like, okay, what do I do with it? Do I store it or do I send it somewhere? But then over the walkie-talkie, the muscles go, oh, we need more sugar, send it our way. And then so the liver goes, oh, okay, and ships it off to the muscles of the horse. What's going on in our metabolic horses is they're overwhelmed. They're not communicating. Those messages are delayed, or the liver's not even listening to the muscles. And that whole system, those pathways are shutting down. And so you get this accumulation of sugar in the body. And what Dr. Aaron and Dr. Tiffany were talking about are some of the ways we can help that, especially when it comes to medications. The flavonoids, which we're finding out in research, is it's helping restore these pathways. So we're seeing things like increased insulin receptor sensitivity, so that those messages are starting to be listened to, and then the liver is processing sugar appropriately. And these are all supported in the horse. And then there's heaps and heaps of data in other species of these flavonoids. The other thing it helps is reduce inflammation. So we regulate those inflammatory pathways. These AGESs, these advanced glycation end products, AGES, are really sticky in the bloodstream. So they almost caramelize tissue, and they get really sticky, and they stick to tissues in these pathways and can lead to some of these processes. So the flavonoids are reducing that. So you're getting less cellular damage and less oxidative stress. The mitochondria is coming back online, it's more efficient, and that communication is starting to flow again in the horse. Now, metabolize with Poseidon Animal Health. Why I'm so excited about this product and why I'm screaming at everybody in the company that we need to be pushing more of this. It's very, very unique, and I have yet to find one in the world that can go head to head with the flavonoids in horses. There are many products on the market that are single flavonoids, and if you go into the research, you can read what they can do and what they can't do. Metabolize has 3 unique flavonoids. Quercetin is incredible. That is the one that's the most supported in the literature. A lot of the research is focused on quercetin. Dihydromycetin and then cholinergic acid are also currently being researched in horses and have support in the literature for helping metabolic horses. And just quickly, you can look at this slide and see what their primary function is. There is some overlap between the 3, but quercetin is the one that research is showing is really helping metabolic horses. There's actually really exciting research out of Texas where it has improved vascularity in the horse. And that's where I get really excited again, especially when it comes to hooves and laminitis. We want to make sure we get good blood flow in the hooves. So quercetin is one of these compounds that are helping horses regulate their blood flow better. And there's been a study in horses that show that. The other one's helping detox the liver, that antioxidant support regulating inflammatory processes, and even fat metabolism. So they have this synergistic effect on the horse. And I mean, the feedback from customers and clients is just it's wow. It's actually that we actually have a testimonial that Metabolize saved a horse's life. And anytime in my career, the last close to 30 years now, where I would get an email or a client would tell me, "You saved my horse's life." That's all I care about. That's all I care about. I've taught over 100,000 people around the world in many of my courses. That one email I got that said, "Your course saved my horse's life," is printed on my wall because I said, you know what? I saved a horse's life. And that's why I get up every day. And that's what excites me every day when I come to work, is trying to help save horses' lives. And we have one that just recently came in, Metabolize saved my horse's life. We were going to euthanize it. I gave it one last shot, and now the horse, as Dr. Aaron's going to show you here in a little bit, of other horses, has recovered and is doing really well.
Dr.
Again,
Chris,
yes,
I
yes.
want to jump in and say, just to make it clear, we are so excited this product is now finally available in the US. Australia and New Zealand have had the benefit of having access to Metabolize, I think, for the last 18 months. But we have, worked so hard to get it. And Dr. Erin's been involved this side, and when she was in Australia, and knows about the magic of Metabolize. So we are very excited that it is finally available, because in the past, when we've done international webinars, we get these, questions from the US. How do we get it? We go, oh, well, you can't at the moment. But that day's finally arrived. So I just wanted to jump in and clarify that, because it is, as someone's written, I think Leslie's written, shock horror that nature actually knows what it was doing. And that's exactly what's exciting about Metabolize. And particularly when you look at the stats around metabolic horses, it's one of those products. It's not, don't wait until your horse is metabolic. It's one of those ingredients that actually should be in every horse's diet. But I just wanted to jump in and clarify it is available. Sorry, Dr. Chris, back to you.
No. Yeah, no, it's amazing. It's back home. It's available. So I'm really, really excited for Dr. Aaron, Dr. Tiffany to see the transformations that they've seen here in New Zealand or in Australia. Science. I was an editor for the Journal of Equine Veterinary Science. I've written multiple scientific publications. I know what goes into those. They're not something to sneeze at. Doing these studies takes many years, lots of hours and analysis and arguments with other scientists about the validity of the research. So when you do see scientific publications, it means something. When you see multiple, that is exciting. And that's where I go, okay, there's something to this. And I've answered some questions, some wonderful questions earlier in the webinar talking about research. And when you have multiple studies saying we see this in horses, then that has us excited as scientists and nutritionists. So these are all backed by science, and can make you feel really good about what you're doing and what you're feeding your horse. But yeah, Metabolize is my favorite. And we have so many great products, but that's my favorite. That's like, I want to see it explode around the planet, because I know it's going to help so many horses. And again, that's why I get up every single morning. So thanks. Back to you, Dr. Aaron.
Thanks, Dr. Chris. I think we're all so excited about all the products that we have here at Poseidon, but Metabolize is definitely a fun one. And I was very lucky to get to spearhead the clinical field trial that we did. It was actually right before I moved from Australia to the United States. And so I'll get to share with all of you some of the results that we found. And it was, as Dr. Chris said, doing research is fun if you're a scientist, but the results that we got with these ponies and the feedback from their owners was the most rewarding part. There was not a pony in the trial that didn't show positive effects. And there were actually a couple in the trial that we did where the owner said, "You have saved my pony's life. We were on the verge of euthanizing this pony." And just like Dr. Chris, that is probably the most heartbreaking part of metabolic disease, is that sometimes we get pushed into a corner where we are doing everything right, but at what cost to the pony? Sometimes we're restricting their calories so much. We are restricting their turnout. We are locking them up. They are sore. We can't work them. We can't exercise them. And you feel, is this pony still happy to be with us? Is there any quality of life here? And that's really sad. And we're going to share a couple of cases with you a little bit later on of ponies that have been in that situation and they've turned around, and that's really exciting for us. That's why we do what we do. So the field trial that we did was a lot of fun and it gave us some great results. I'm always my biggest critic, and the cool and also shortcoming feature of this clinical trial is that we actually only were able to give our trial participants Metabolize for 2 weeks. So we saw fantastic results, but it was a very short period of time, which is cool because it shows that it works so quickly. But I also would have loved to have been able to continue the trial longer, because I know the results would have been even more staggering if we could have kept them on the Metabolize for longer. So what we did was we had a group of 5 ponies. They were initially put onto a control diet, so a low sugar, low starch diet. We gave them 2 weeks to acclimate to that, to make sure that the results we were seeing weren't related to the change in diet. And then once they'd been on the diet for 2 weeks, they were then given Metabolize for 2 weeks. These ponies were kept at home. They stayed in their normal exercise routine, whatever that was, and they were managed as per normal. We did change their diet in that 2-week period, but otherwise, whether they were ridden or turned out or stabled or what have you, that all stayed the same. The things that we evaluated were their crusty neck scores, their lameness and behavioral changes. We did their glucose and insulin response with the oral sugar test that Dr. Tiffany described earlier. All of these evaluations were done by independent veterinarians. So the veterinarians didn't know what was going on. They just came in, looked at these different variables, recorded their findings, and we used a different veterinarian at each interval so that they wouldn't know what the pony had looked like at day 0, day 14, or day 28. So what did we find? Crusty neck scores across the board reduced. So following treatment, our mean crusty neck score significantly decreased in all of our ponies. And again, this was only after 2 weeks. So I would love to repeat this for longer, because I know that we would just see incredible results if we could have these ponies on Metabolize long term. But every single pony showed us a reduction in crusty neck score after treatment with Metabolize. We also saw an improvement in their lameness scale. And as Dr. Chris discussed, one of the really cool things about Metabolize, and in some ways I actually think we should rename the product or repackage it with a different name, are the anti-inflammatory properties. I actually have 4 show jumpers. They are all sport horses. None of them have metabolic issues, and they are all on Metabolize, because the anti-inflammatory properties in these flavonoids, horses need them, and it makes such a difference in their soundness. Again, that has to do with vascularity. It has to do with the antioxidant potential, the anti-inflammation potential. But all of our owners reported their horses were more free moving. They were happy to go forward. Their lameness scores decreased, which shows that they had a reduction in discomfort or stiffness. And what's really exciting about this is that a big factor in our horses getting stuck in this vicious cycle is that they're too sore to work. So I see so many patients and so many owners where I say your pony needs more exercise or your horse needs more exercise. They say, I'd love to exercise them, but they're too lame. I can't exercise them. So getting horses sounder, allowing them to be able to move more freely, gets us back on that train of being able to exercise them. And that is going to allow us to get more calories off. That often allows us to be able to turn them out more or keep them on turnout. And that just improves their quality of life so much. This is a huge effect to see after such a short period of time. We also saw lowered glucose levels after treatment in our oral glucose sugar test. So the ponies were given sucrose in their meal, and then we waited 90 minutes and we tested their glucose and insulin levels, and we saw a decrease in the amount of glucose that showed up in their bloodstream when we performed that test after 2 weeks on Metabolize versus when we performed that test after just 2 weeks on the controlled diet. And that's a huge change, because if we have less glucose in the blood, we know that we are reversing some of that insulin resistance and increasing our insulin sensitivity, which is really exciting. We also saw lowered insulin levels. So what's really cool about Metabolize is it works at 7 different stages of the glucose and insulin metabolic pathway. So it's stopping them from absorbing as much glucose. It is directing the glucose to active tissues. It's increasing excretion of glucose. So what that means is not only are we seeing less glucose in the bloodstream, we're also seeing less insulin in the bloodstream. So we know that we are going to, over time, reverse some of that insulin sensitivity, insulin resistance, increase insulin sensitivity, and we're going to get these horses out of that cycle of just constant inflammation, constant stress, constant resistance. We're actually going to start to send them in the right direction, which is really cool. So what did we see? Improved insulin sensitivity, a reduction in fatty deposits, an improvement in lameness score, a reduction in that crusty neck score. So all of the things that are problematic and contribute to that vicious cycle that we've been talking about, we're actually reversing those effects and stopping them from progressing. And what's great about this product is that it's all natural. It's not a medication. There are no side effects. As I discussed, I feed this to my healthy sport horses because just the anti-inflammatory properties alone and the improvements and benefits in their health. And also because, as we've discussed, we want to prevent horses from going down this metabolic road, right? Obviously, we want to intervene once we're there, and we want to help get our horses off medication because, as Dr. Tiffany showed us, medications aren't the answer to everything, and they're normally for just an acute crisis. But I actually love this product for healthy horses as well as a preventative. These flavonoids were meant to be consumed by every horse, and they just aren't getting access to them anymore. So being able to introduce this back into their diet is great, not only for their metabolic health, but also for their GI health and their inflammatory system. So I think Dr. Chris covered this pretty well, but the key benefits of metabolize that were shown in our field trial are obviously that it supports glucose and insulin regulation, the healthy glucose and insulin regulation that should be happening in our horses naturally. We reduce inflammation naturally. We enhance the horse's antioxidant defenses, stabilize their gut microbiome and barrier, and we help horses that are prone to laminitis or metabolic syndrome get out of the vicious cycle or prevent going into the vicious cycle. The other thing that's really cool about this product, I get asked all the time what the best joint supplement is on the market. And oral joint supplements notoriously have a lot of problems with bioavailability in the horse. We can come up with the best list of ingredients you could possibly want. But if we can't actually get the horse to absorb it from their tract into their bloodstream, we can't get those ingredients to the joint. The really cool thing about flavonoids is they are nature's anti-inflammatory. So they are designed to be absorbed. They're designed to get into the bloodstream. They're designed to reduce inflammation. So outside of metabolic health, this is a phenomenal product for all horses and is great for joint health and every other inflammatory system that we might have going on. So now we're going to go into our case studies, which is always the most fun part. I never get tired of looking at cute photos and videos of horses. And these horses in particular, Posh and Pom, belong to Linda. So we are all very personally invested in Posh and Pom. So Posh started, she was a 22-year-old Welsh A pony. In October 2023, she presented with a left hind limb lameness and a high body condition score. She was actually negative for PPID despite hypertrichosis, which is that hairy coat, and advanced age. It is possible it was a false negative. A couple people asked about timing of testing for equine Cushing's, and that is an important factor in the testing. So always important to talk to your veterinarian. And remember, no test is perfect, as Dr. Tiffany describes. If you get a result that doesn't seem to fit the picture, it can often be worth retesting. Regardless of that, Posh had radiographs taken on the 16th of October, and they showed a significant rotation in both hind feet and a mildly clubbed right foot. I think, yeah, so we're going to have a before video of little Poshy. You can see that she's quite uncomfortable. She's what we would describe in vet school as student lame. Almost anyone can identify that she is lame and in which leg. So thank you, Posh, for being a good advocate for yourself. So this is where Posh started. So she did all the right things Linda did with her pony, as Dr. Tiffany instructed. She had her bloods tested and her insulin came back at 250, which is very high on any scale. She was instructed to commence treatment with etripamil, which she did. And Linda also started her own metabolize at the same time. And we can see on this graph to the left her levels over time. So she was tested regularly, as Dr. Tiffany instructed. And the medication absolutely helped and it brought her levels down. But as we know, we can't stay on these medications forever. So her medication was stopped. And you can see that her insulin level did bounce back a little bit after the stopping of medication, but it then continued to decrease steadily after stopping medication because we had the metabolize on board. What was particularly exciting about Posh's case and gives us a lot of hope for those of us trying to manage these guys is that Posh was able to remain on pasture and remain on turnout throughout this treatment. So she was able to keep moving. Her quality of life stayed good. She was able to keep the exercise level up that was appropriate for her age and stage of life. And then once we removed that medication, her insulin did not go to an unhealthy level, but it was able to then stabilize and continue to lower with the metabolize on board. So that's for us the ideal sequence of events, that we are in a crisis. Ideally, we don't want to get to the point that we're in a crisis, but if we are in a crisis, we start medication, we start metabolize. Once the medication has had time to work, we remove it as soon as we can. And then we're able to continue with the metabolize and see those blood results continue to stabilize. So it's really important that we use all of our tools judiciously and that we consider that most of these medications were not designed for horses. They're designed for humans. So we need to use as little as possible, as often as necessary, and lean on the other tools that we have that are natural and more designed for horses. And this is beautiful Poshy after. So she has a normal insulin level. She's obviously much freer in her movement, much sounder, much happier. She's even got some sass towards her paddock mate. and she is enjoying her quality of life. And that's exactly what we like to see in all of these guys.
And Dr. Erin, just Posh is still with me and her insulin levels have never returned. I think 50 might have been the highest since then. She's maintained on metabolize. I do my regular blood checks. I test her for insulin, for Cushing's. And this was a mare that we were thinking we would have to euthanize her because she was not happy. I was very lucky to work with a vet that was happy to work with me. Other members of the team were very concerned that I was keeping Posh on grass. But for me, I really wanted to test to see what would happen because it wouldn't have been a quality of life for her to be locked up anyway. And it was the most, even my vet was just like, oh my goodness, this is amazing. To be able to maintain those insulin levels and to keep her happy was when the great excitement, even more excitement about metabolize happened. As you know, I was sharing those results with you. And somebody asked in the chat about, can you use, I can't say properly, a tuberflosin with metabolize. And there's an example of how you can work together with your vet and doing things a bit differently. So anyway, it's an amazing case study. Thank you, Dr. Erin.
No, Posh is a great story, and it's a real credit to you, Linda, how well you've managed her and how you've looked after her. And it's great for us to be able to have all those results. And there were, I mean, we could share a lot of cases. There was a beautiful pony that was in our clinical trial, and he was in a dirt stall. He was locked up all the time. He literally sat at the back of the stall all day. He could barely be fed anything because he was so overweight and laminitic. And he was really on the verge of being euthanized. And within 2 weeks on metabolize, he was trotting around, cantering around. They turned him out. They were able to ride him again. And just the change in that pony and his lease on life. And just like you know, these older horses, not just ponies, but the older horses as well, they've given us so much. They have usually competed with us and then our children, and they've given everything. And then at the end of their life, you don't want to see them sad and locked in a dirt yard or not being able to be with their friends and not be able to eat grass. And so having an option that is natural and healthy for them, that allows them to maintain that quality of life, I think is really life-changing. Okay, our next case is Kizzy. And Kizzy is a 16-year-old Appaloosa mare. And you can see when she was purchased in 2023 that she was significantly overweight. She also presented with low energy. And that is one of the sort of early signs. I mean, I am seeing now, I'm here in Florida, and we have obviously a lot of competitive horse and a lot of competitive horses and horses that are imported from Europe. And sort of this presentation of low energy or a lack of spark, even in young horses, 4, 5, 6, 7, 8-year-old horses, that's often one of our first indicators that we need to assess their metabolic state. So low energy, we hear that a lot. In the summer of 2023, her insulin was tested and it was 129. 4 weeks later, they started her on metformin, 28 tablets a day. They retested the insulin as Dr. Tiffany recommended, and it was 152. So it had actually gone up. They then increased the metformin, which is standard practice, tested her insulin again, and it was higher still, 204. And then finally, they decided they needed to do something different, and they started her on metabolize. So 3 months on metabolize, and her insulin had gone from 204 to 69. Her crusty neck and fat pads had disappeared. Her body condition score had improved dramatically. And in particular, that behavioral change that we're looking for, it was a dramatic improvement in her comfort level and her energy level. So her desire to move, her desire to do her job. One note that I want to add to everyone is that the before picture was taken in the summer and the after picture was taken in the winter. So Kizzy hasn't aged that much. She's just an Appaloosa and she's grown her winter blanket. But she looks a much healthier horse and she's a much happier horse and a horse that wants to actually do a job and has some energy. And that's really important because 16 nowadays is really not that old. She should have a lot of life left in her and she should really be able to still be contributing and be useful at that point. So Kizzy is a great example of the changes we can see when medication isn't working. And our last case study is River. So River is obviously an ex-show pony and obviously contributed a lot to the people that have enjoyed her and competed with her. She had a chronic history of equine metabolic syndrome and laminitis. She'd had a lot of diet and management changes, what we would call conservative management, which is, a little bit more. The medications are still fairly new, and there are a lot of veterinarians out there who are not comfortable using them. And some of that is because they're not designed for horses and they're not labeled for horses. And some of that is just they are still new on the scene, and a lot of vets don't know about them or aren't comfortable with the consequences. So she was managed conservatively with diet and management changes. Her owners were transitioning her from shod to barefoot to try to help with her soundness. And this conservative management was keeping her alive, but definitely not thriving. In 2025, they ended up introducing metabolize. So we've got a video of River before. So this is before she was started on metabolize. Remember, she wasn't on any medication, but she was on conservative diet and management. And you can see that she is a very unhappy, uncomfortable, and cranky pony who, to me, if I was called out to look at this pony as my patient, I would be concerned about her quality of life because this is not a pony that looks real happy. And obviously, she has a beautiful little girl leading her that I'm sure loves her very much and wants to be able to enjoy River and doesn't want to see her pony looking like that. So after metabolize was introduced into River's management program, this is her now. And this is the kind of stuff that just absolutely warms my heart to see a pony and a girl enjoying each other, loving life, ears forward, happy to do a job. That's what we hope. They say there's nothing better in life than to be loved by a little girl. And I think that's 100% true. And you can just see what a difference just adding the metabolize has made into this pony's quality of life and her ability to contribute and be a part of the family. So this is, I think, for me, why we do what we do. Yes, we love to save horses' lives. And when we get those letters, it's amazing. But even just being able to make this little girl happy and have a pony here that is enjoying herself is just amazing. And to do it naturally.
That's a great case study, that last one. I mean, gosh, what a difference. And again, back to what Lindsay said, Mother Nature, so clever. It was all there. And interesting, going through this webinar, there's so much of this that relates to humans as well. And we just have taken away things that are just so magical and have a role to play, and it's about putting it back in. And we know that in Australia and New Zealand over the last few years, there are so many testimonials that we get. I actually haven't seen that last one, but I've seen so many. And it just makes you so proud that we are giving these horses quality of life back again. Oh, there's so much to unpack here. I forget that I'm hosting this webinar. I'm so intently listening. We've got 10 minutes left. Thank you, incredible team. Your job's not done yet, though. We've got a few more things to go through. What we've done, there's been a few key questions that have come through, and we're going to try and get through a couple of those. I'm going to open this out to the panel. So Dr. Chris and Dr. Tiffany, if you'd like to turn your camera back on again. And we haven't actually done it like this before. This is a new approach. So perhaps, Dr. Erin, you might be the gatekeeper and decide who is the right person to answer these questions. So here's one. My horse was just diagnosed. He is on the slimmer side. Everything I see with EMS is they're overweight. He is not. How can I safely get weight on him?
I'm happy to take this one, Linda. I actually think I did
Okay.
answer this question but it's probably, if one person's asked it, probably more people have asked it.
Okay.
So if we're trying to put weight on a horse with metabolic issues, we want to do that with non-structural carbohydrate forage. So forages that are less than 10% ideally. I know everyone who's been answering has been harping about testing hay and testing forage and testing pasture. I also recommended, and this is actually a good point to me, I recommended to this person that asked this question, including some alfalfa in the diet. And I think we all know that I love alfalfa a lot, or lucerne a lot. And I recommend it for almost every horse. And I had a lot of our attendees in the Q&A asking me if alfalfa was safe for metabolic horses, and it absolutely is. Alfalfa tends to test very low in NSC. It has fantastic protein and amino acid profile, which is great for hoof health. Most of our metabolic horses struggle with their hoof health. So I think if we can debunk that myth, I will be very happy that alfalfa is not good for metabolic horses. It is obviously a calorically dense feed. So I usually recommend it, and Dr. Chris, feel free to jump in. I usually recommend it at 25 to 30% of the diet, but it's a really good piece of that variety of forage for these horses. And then the other important parts are obviously just testing all of the other forage we're feeding this horse. But forage would be the way I'd put the weight on, and making sure that we're testing it. Interestingly, not to set a cat amongst the pigeons, I am normally a huge proponent of beet pulp. I think everyone that knows me has heard me bang on about beet pulp. Dr. Tiffany and I just came home from the AAP conference in Denver, Colorado, and a group of nutritionists was informing us that beet pulp can actually be very variable in how it tests for NSC, even if it says low NSC on the bag. So I certainly am not going to get off the beet pulp bandwagon. I love it. But if you are managing a metabolic horse and you think you're doing everything right and you're still struggling, particularly with laminitic flares, and you are feeding beet pulp, I would consider pulling that out, because it is possible that that is contributing to the issue. So I love beet pulp. I think if it's test low, it's a fantastic addition. It's great for variety of fiber. It's great for the hindgut. It's great for any number of things. But it does seem like it can be variable in its testing. So it's just something to consider if you are having issues and that is a component of your horse's diet. Normally, I would immediately recommend beet pulp for this horse as well, but that's what sort of stopped me from doing that.
Yeah, just to jump in real quick, yeah, Dr. Erin, I mean, we've 74 answered questions. All the questions are incredible. Thank you for all of those, and hopefully uh, forgive us for our spelling errors. Typing furiously, I can even see Dr. Erin in the background typing furiously. The only component we can't talk about, we don't have time to talk about, is gut health. And what Dr. Erin was saying, that hind gut, we need to make sure those microbes are balanced, because that's where the horse gets most of their energy. And so in future webinars, we'll be talking about it. In past webinars, we've talked about it. But that's the other component of this that we just didn't have time today to come over, is we want that gut functioning at the level it needs to be, and those microbes balanced to help control some of this other stuff. But yeah, I mean, awesome questions. So thank you for all of those. And we'll try to answer some more before we sign off.
Thanks, Dr. Chris. And hopefully after this webinar, you'll be curious, you want to learn more, jump on our websites. And on our website, we'll also talk about the role of gut health and our foundational gut products that we have. Again, we're doing it differently. We're looking at the whole gut, how it has an impact on not just weight, but behavior and performance, etc. So we're just trying to, we don't want to be a company that brings in 20 or 30 different supplements. It's like each supplement has to have a genuine role to play. And that's why we only have a certain amount, and they each offer something different to allow these beautiful animals to be the incredible beings that they are. Okay, another question. How close to foaling should metabolites be stopped to not affect fetal growth and lactation?
I jumped in and answered that one because I did do research when I was in Florida, feeding arginine, which was helping vascularity in the mare. And that was my focus, was looking at impacts. So we do not have any data feeding metabolized to pregnant mares, but these are natural compounds. These are things that wild horses would be eating in the wild in nature. So there's no data to indicate that this could be harmful in any way. From the research that I did do, we found we had no issues with foaling, no differences in size of the foals, but the big benefit for us was mares' involution rates were much, much better. They cleaned up much quicker, so we could get them in foal a lot easier for the following year. Now, that was feeding an amino acid, metabolized a little bit different. That's why I said the vascularity really excites me with this. But these are natural compounds. It's nothing artificial in there, so there shouldn't be anything detrimental to the mare or the foal. But again, we don't have research in it, and there isn't any equine research out there feeding this to mares. I just need a research herd here that Linda can pay for, and I'll do the work because I'd be so excited to do some of this stuff. Metabolize is just fantastic. I just love it. It's such a great product.
Fabulous, thank you. But I think we have got time for one more, and it's reassuring to know these questions have also been answered in the Q&A. So jump on there and have a look. And I wanted to say, you should see the comment. You probably can't all see the technical team, but the comments in the webinar chat are amazing. You guys should be so proud of what you've presented today. There are so many comments saying this has been really interesting. They've learned so much, and we've done a lot of webinars, and so I can tell when a webinar has really hit the spot. And they always do, but this has almost gone to another level. So hopefully you can just quickly scan through those and have a read. Okay, next question. Is it recommended to use metabolized once the horse is controlled with medication to get the horse fully off medication, like the first one, I think it's levothyroxine or empagliflozin?
I can take that one. Yes. So I would recommend that Metabolize be started as a supplement at the same time that you're beginning the changes in diet management and medication for those acute cases. And then, depending on the scenario and the horse, trying to wean off the medications. As I mentioned, I think for me, the ertugliflozin is the one that I want off as quickly as possible because I think it has a pretty narrow safety margin in people. And so it's a little bit concerning in horses. We can't quite predict if horses will have the same issue. We haven't been using it as long, probably just over the last 12 to 18 months, I'd say, in the US commonly. Previously, it was, really non-responsive horses that got it. Now it's pretty common for horses to go on it right away. The levothyroxine, horses are not often hypothyroid. It's a very, very, very rare situation where a horse actually has hypothyroidism. And so most horses do not need that. So it's another one I recommend just for short-term use in order to get weight off, improve insulin sensitivity in the short term, and try to get horses off of that within 6 months.
Excellent. Thank you, Dr. Tiffany. I'm going to finish with one more question because I think this is a really great one. What would you and I think Dr. Chris, this could be one for you. What would you consider a low NSC level? Companies label it under 10% safe. And I'm not sure what it's like in the US, but I know in Australia there are lots of feeds labeled low starch or low NSC, but they are certainly not. And there's also the myths around, as Dr. Erin mentioned, that alfalfa or Luton hay is high in sugars. And in Australia, we have a hay called teff hay. I'm not sure if that's in New Zealand and the USA. And there's also a myth that it's always low, and it's actually not. So lots of confusion. But Dr. Chris, what is considered a safe level?
10% is the benchmark because that's what the research has shown. Now, remember, horses still need sugar. They still need it in their body, just not at the levels that we fed for so many years. And then that was the grain diets. I mean, I tell this story. I was, 25 years ago, I was out, steam crib corn. That's what we fed our horses. We didn't know better. Now all these metabolic issues are coming up, and we're like, whoa, we're overwhelming the horses with sugar and starch. So I did see a comment where somebody felt 6-7%. Just remember 10% is kind of that benchmark. And like Linda said, I've done multiple product reviews and there's a lot of products on the market. I can't believe they market it as low NSC, and you just look on the feed tag and it's 15 to 20% NSC. And they could argue, oh, well, this, that, and the other, but you just have to be very, very careful out there. But 10% is still the benchmark used in nutrition science.
Fabulous. Thank you, Dr. Chris. We are just about at the end of our time. So again, thank you everyone for jumping in. Someone has asked whether their question has been answered. iPhone Liv, I guess that's your tag. We can just double check and see if that one's been answered. But so much engagement. Thank you, everyone. We've had record numbers turning up for this, and what we get to see who stays around, and people who have left have apologised, didn't actually want to leave, but they had to do other jobs. So again, we'll send the webinar recordings out. We do have some names to announce as the winners. From the USA, Emily Mosher. From Australia, Jan King. And from New Zealand, Donna Anderson. So I would imagine our team will be in touch with you, or if you can contact us. Is that the correct process? But the team behind me give me all the answers here. Again, thank you, everyone. So much work goes into these webinars. And as you can see, our team are so, they're so capable of answering the questions and presenting the presentation. But I just want to do a shout out to everyone that's helped. We have an amazing team at Poseidon. We have every team member just loves doing what they're doing. So a huge shout out to my team for making this possible. And again, to Dr. Chris, Dr. Erin, and Dr. Tiffany, thank you for making, our horses' lives better. Thank you for jumping in and sharing your knowledge. You're also humble, because collectively the experience of these people is incredible. And I, every day, am grateful I get to work with them, because Poseidon is such a gift in so many ways. And again, looking at the comments in the chat about people saying they do already use our products and they love them, which is fabulous. We take your trust in us very seriously. We know that there's a lot of information out there. There's a lot of supplements over there. It's overwhelming. So what we need to do is make sure we can bring you the very best that we can. So again, thank you so much for joining us. Thank you again to the team for being part of this webinar. And thank you to everyone back at Poseidon for all the help in bringing this webinar to life. Enjoy the rest of your day, evening, morning, wherever you are. And we do pinch ourselves that this company that has started with such a commitment to making lives better is now global. And having spent quite a lot of time in the US in the last 12 months and seeing the US start to really embrace what we're doing is really exciting. We've had long-term support from Australia and New Zealand. We're always grateful for that. So again, thank you, everyone. Thank you for taking the time to answer the poll. Jump back into the Q&A and make sure that you have read some of the other questions and answers. If there's anything that we haven't answered, if you have a burning question, please do not hesitate to contact us. We have an incredible customer service team. They're not bots, they're real people that work with our experts that you've met today. So any questions that come in, they will then refer to whoever it's appropriate to answer, one of the vets or nutritionists. So if we haven't answered your question, don't hesitate to reach out, because there's so many of us here. We probably haven't gotten through everything. But that's all from me. Again, thank you for joining us, and thanks again to the team.